Good morning. So today's class is just like a continuation of previous class. Changes, physical changes, system-wise changes which we are seeing in old age. So age and immune system. So in this, the efficiency of immune system declines over time. So but this is variable among the persons. There is individual uniqueness always. Non-specific defenses become less effective. So we know that specific defense is there, non-specific is there. Non-specific are innate immunity, specific are adaptive or acquired immunity. I hope you all know about immunity. So the ability of body to make antibodies diminishes, so that the autoimmune disorders increased during the old age. So regarding the thymus gland, it reduced its size, and the peripheral T cells proliferate much less in old age. So T cells, one of the major cell which is having the immune power. So the old age persons will be having high risk to get infection. So common infections are more often severe, with slower recovery and decreased changes of developing adequate immunity. So these all things can be seen because the immune cells are itself not producing properly. So that is about immune system. Coming to the sensory changes in eye, by seeing the old age person's eye, we can find out how much changes it is being taken place. Besides that, there is diminished ability to focus to the close objects, a decreased visual acuity, the cornea changes, and it will reduces the refractory power. That is the cause. So the eye's external changes give evidence of advancing age. So these changes result from loss of orbital fat, loss of elastic tissue, and decreased muscle tone. About the retina, it will become thinner due to this problem related to reading, not able to see the dim light, and difficulty in color perception. The lens of the eye loses the elasticity, hence the visual acuity also decreases. That is about eye. Coming to the ear, we know that presbycusis means age-associated hearing loss. So hearing problem is one of the major factor we can see. And about the cerumen, it will become more dry. The earwax will become very hard. Cerumen and earwax are same, okay. And old age persons will be having itching also. So degenerative changes occurs in ossicles. So what do you mean by ossicles? So just message me what are ossicles. So there will be degenerative changes can be seen in ossicles, and that also contribute to hearing loss. And regarding the taste and smell, decreased ability to taste and smell. But very rarely the capacity to smell diminishes, but sometimes it diminishes, mostly in some persons. So taste perception as well as taste discrimination also is been seen as the age advances. So that is about ear as well as taste and senses. Coming to the integumentary system. So about the skin, by seeing the skin we can see wrinkles, dryness, perspiration is less, and easy fragile and easy breakdown or peeling of skin, loss of skin elasticity, and easy trauma to the skin. So whatever coming to the mind, all those things you can write, because everything will happen in old age. So decreased elasticity, decreased perspiration, thinning of skin, decreased heat regulation, decreased protection against any trauma and solar exposure. The number of pressure, touch as well as light touch decreases with age. That is the sense of touch. Immune, vascular, thermoregulatory responses of the skin decrease with aging. Loss of hair color, and thinning of the pubic axillary and scalp hair can be seen. And continuing, decreased function of sebaceous and sweat glands. That is why the person is having dry skin. Facial lines around the eyes as well as mouth and nose. So hardness and dryness over the nails. It will become more brittle. Decrease in nail growth as well as rate and strength. Toenails may discolor. You can see discoloration in the toenails. Scalp hair will be thinning, mainly affecting the men. Melanin will be decreasing. As a result, the color also will be changing to gray. So increased growth of nose hair, ear hair as well as facial hair. That can be seen in old age. And while looking into the epidermis, the number of epidermal cells decreases by 10% per decade, and they divide more slowly. So the skin's ability to repair itself will lose. So epidermal cells will become thinner, making the skin look noticeably thinner. And നമുക്കറിയാം കൈയിൻ്റെ കയ്യോ കാലുകളിലോ നോക്കിക്കഴിഞ്ഞാൽ സ്കിൻ ഇങ്ങനെ മടങ്ങി തൂങ്ങി കിടക്കുന്നുണ്ടാവും. So that is due to epidermal thinning. So changes in epidermis allows more fluid to escape from the skin. So there is chance of hypotension or less amount of fluid in the body. So making skin more fragile and making it easier for the skin to shear due to that. So this process also decreases the amount of nutrients available to the epidermis by decreasing surface area in contact with dermis. Slower repair turnover. And the changes we can see in dermis. Here also changes in the dermis cause wrinkle as well as sag formation. Dermal layer also will become thin. The collagen production will be less. The elastin fibers will lose its function. So decreased function of sebaceous as well as sweat gland. That also seen leads to dry skin. We already discussed in the previous point. So observed skin changes which mainly seen in subcutaneous tissue. The fat cell gets smaller. Same thing, wrinkle as well as age-related changes can be seen. So that is all about the changes which we can see in the skin.